This is your child's nervous system. So where on any regular day, they're going to run into all kinds of different things, like itchy clothes, a loud classroom, they forgot their homework, there was a change of plans. And these may seem like small things, but to a child, teen, young adult with AuDHD, having both autism and ADHD, these things can build up and build up throughout the day and get bigger. So where eventually their nervous system can't take it anymore. And that explosion, that's not defiance. That happens whenever we expect more from our neurodivergent children than what their brains can handle and what it was wired for. Today, I'm going to talk about why emotional regulation for kids with AuDHD is so difficult and what actually helps. From sensory tools to co-regulation techniques, I'm going to walk you through 5 different ways that actually help and makes a difference, and not just for your child, but for you. Children with AuDHD often experience the world like a tidal wave of sensory input and emotions and unspoken rules. And they tend to mask it all day long, especially while they're at school. And then when they get home, you see them crash. They go to their room, they cry, they're having an emotional meltdown. And this isn't because that they're being defiant or that they're having a tantrum. It's because they are overwhelmed with what has happened throughout the day, and they were trying their best to keep everything together. Research shows that kids with ADHD and autism have difficulties in several different areas. One area is inhibitory control, so being able to stop themselves before they react or act. Another one is called cognitive flexibility, so being able to adapt when there's changes to the plan or expectations. Another one is what's called interoception, so being able to recognize internal cues to their stress or hunger. And what this can look like is that they are so hyper-focused on their fixated interest, or they just lose track of time to where they get extremely hungry but don't realize it. Or maybe they're getting really stressed out and they can't quite put words to that or where it's coming from. And of course, another challenge that kids with autism and ADHD have is emotional regulation. So being able to control the intensity, frequency, and duration of how their emotions come up and be able to pull themselves back. And when both of these diagnoses are present, ADHD and autism, it's not like they cancel each other out. Rather, they compound on one another. So what does emotional dysregulation look like? Emotional dysregulation isn't always the loud, big blow-ups that we may think about. Rather, it can show up in various other ways. So it can look like a child who shuts down and goes nonverbal, or perhaps a teen who explodes over what seems like nothing. Mood swings that seem unpredictable, refusing to do a task, not because they're being defiant, but because it feels unsafe to them. And emotional dysregulation can also look like repetitive behaviors. So what can also be called stimming or motor stereotypies, to where they're flapping their hands, or they're pacing back and forth, or body rocking. Or another one is different language stereotypies, like echolalia, or using scripts. And the purpose of these is that they're self-soothing and helps them calm down. So now let's go into the 5 different strategies that I see work with kids with AuDHD. One strategy is to build what's called a sensory toolkit. Now, every kid's going to be a little bit different, to where every kid's going to have different sensory needs and sensory seeking behaviors. So being aware of that is going to be key. But different things that you may think about and include noise canceling headphones, a weighted blanket, lots of fidgets, something that's called chewlery, to where they're able to chew on things a little bit, and movement breaks, being able to allow them to get up, move around, pace around the room. These things can help. And I want you to think about it to where these aren't rewards, rather they're supports. Just like how glasses help you see, these are tools to help kids regulate. The second strategy that I see work is what's called to teach interoceptive awareness. So one way to do this is to do what's called a body map. And with kids, I'll usually bring out a gingerbread man, like a figure of a human being, and we'll color different things in it. Red could be their anger, and maybe they feel it in their stomach. Or maybe if they're sad, they've got blue little dots coming down from their eyes. Or maybe if they're upset, they put black dots over their head, which shows that it's hard for them to think straight. Another tool that I use is what's called a feelings thermometer. So I have them rate their feelings, whatever it may be. Like, let's just say that it's anger. And 10 is the most angry that you've ever been. 0 is you're not angry at all. And I have them rate each different level. What does a 2 look like? What does a 5 look like? What does 8 look like? And that way we start building that awareness. We're starting to put what feels difficult to put into words more visual. And especially with this tool, with any of these tools, you're going to practice it before there's a meltdown. The more that you practice these things, the more likely they're going to be able to use these skills and bring themselves back down. The third tool is to co-regulate before you problem solve. When kids are having an emotional meltdown, logic is not going to work. Saying the phrase, use your words, is not going to work. Instead, what you need to be doing is to use minimal words. You can just say, I'm right here. And notice how I do that. It's a nice, calm presence. Another one is to sit calmly, but in their proximity, so they can see that your calm can become their calm. And try and help them breathe through it. So helping them just slow down their breathing. Taking nice deep breaths in and out, encouraging them to do that. And only when their emotions start to go down, that's when you can talk about it. That's when you can start using language. The fourth strategy is to be able to use scripts and visual supports. So teaching them the script of, I need a break right now, or this is too much for me, or even, can I do this later? And what you can do is even put this on postcards or note cards, and they can hand it to you. Again, when they're emotionally overwhelmed, they might not have these words, these scripts that they would have practiced may be too much, but they can pick something up and hand it to you. And the fifth strategy is to create predictable transitions. So transitions for kids with AuDHD is often very anxiety provoking. So different things that you can do to mitigate that and make it a little less severe is to give warnings, is to tell them of an upcoming transition. So after dinner, we're going to go brush our teeth and then we'll have bedtime. Another one is visual cues, or having a visual schedule up so they can see what's going to happen. Oh, in a week from now, my grandparents are coming over. In 2 days, my grandparents are coming over. They can see it get ready to happen. And of course, another one is the use of timers. So being able to set like an egg timer for 5 minutes. Hey, in 5 minutes, we're going to get up and we're going to do this other thing. Or in 2 minutes, I need you to go put your clothes away. That way you don't spring these things on them. Now they expect it. Now they know. So let me go over 3 common mistakes to avoid, and I often see these pop up. So where the first one is not to punish a meltdown. Meltdowns are not a behavior problem. It's a safety response. Another one, like I mentioned before, is don't say to them, use your words. When they're in the middle of this, their brain literally cannot use words. The brain is designed in such a way to where you've got the right hemisphere and the left hemisphere. The left hemisphere is all about logic, to where people are able to use their words. right? But the other side, the right hemisphere, that's all about emotions. And when folks are having a meltdown, their left side of the brain is not activated. It's all the right side of the brain. So that's the side that's extremely activated. And asking them to use something that's on the other side of their brain that's being shut off at the moment, it's just unrealistic. And the third one is don't mistake calm for regulated. I often see neurodivergent kids mask to where on the outside they may seem calm, but on the inside they are in emotional overwhelm. They are trying everything to keep it together. So how do we support kids and teens with AuDHD? Teens nowadays with AuDHD are experiencing all kinds of things: academic stress, social pressures, identity exploration. They may suppress their emotions in order to appear more normal. They may lash out when they're overwhelmed. And then afterwards, they feel guilty and ashamed at how they reacted. So how can we support them? We can use various different means like art or journaling to get these emotions out. Sometimes emotions are very difficult to put into words, especially for neurodivergent kids. So having them channel their feelings into different art projects, painting, crafting, designing something, or journaling, to where they have to write out what their thoughts are. Just getting it out and putting it on a piece of paper can be huge. Another one that we can use is the 5, 4, 3, 2, 1 technique, to where you're using all of your different senses. Look at 5 different things that you can see and be mindful of those. Acknowledge 4 things that you can feel sitting in your chair, something that you're touching, paying attention to 3 things that you can hear. So maybe you can hear the hum of the HVAC system. Maybe you hear a bird outside. 2 things that you can smell. So really picking up on the subtleties that's in the room. What are the different scents that you can smell? Maybe you can smell mahogany. Maybe you can smell vanilla. Maybe you can smell the cinnamon rolls that were made earlier this morning, but you can still smell it lingering in the air. And of course, the last sense is taste. So what are you tasting right now? What's the remnants of the last thing that you drank or that you ate? Can you still taste that, even just a little bit? So these things are mindfulness-based, to where it brings us back in touch with the present moment and what our bodies are experiencing. And another one is to reduce non-essential tasks during stressful weeks. Everyone has a stressful week now and again. Maybe they got into a fight with one of their friends. Maybe it's finals week. So you can ease off some of the chores that are usually theirs during that week. And of course, lastly, you probably guessed that I was going to say this. I'm very biased towards it, but therapy, and especially therapy with a neuro-affirming therapist, because they're going to be able to get your child much more effectively than just a regular therapist. Any therapist that's worth their weight in salt is going to be able to work with your child, your teen, on anxiety and depression. But having a neuro-affirming therapist who has a background in working with autism, ADHD, AuDHD, that's going to be much more effective than just a therapist that works on depression and anxiety, because they're going to be able to see your child through that lens first. Regulation isn't about control. It's about safety. So if your child's emotions seem too big, keep in mind that their nervous system is speaking a different language. And your job isn't to silence that. It's to translate it and to co-regulate and to make them feel safe. And above all, to help them trust themselves. I would love to hear from you. Let me know what emotion regulation skills that you've used in your home, what's worked, what hasn't worked, and make sure to hit like and subscribe, because I've got other videos that come out for kids, teens, young adults about autism, ADHD, other known as AuDHD. In fact, here's one right here. So hopefully I see you there. Bye-bye.